Thank you. And thank you to everyone who made this conference possible, and to the audience for hanging in this afternoon. The big green button. Okay. So yeah, I'm going to be talking about age differences in psychological distress during the COVID-19 pandemic. Oh, thank you. So as we all know, the COVID-19 pandemic has been associated with significant societal disruptions. In particular, people who are older have experienced higher mortality and more severe complications from the COVID-19 virus. Because of this, some of the initial thoughts about mental health during the pandemic were that older age would be associated with greater risk for psychological distress. Just look at you. Yeah. Thank you. Be like the old days when we had overheads, right? But actually, one of the first study that looked at this question during the first month of the pandemic showed that actually older age was associated with less depression and anxiety. And it's not that older adults weren't aware that they were at higher risk. Older age was associated with a greater perceived risk of dying from COVID-19. But despite this, there's still this age-related advantage for psychological distress. And it's not just a quirk of the US. Similar findings have been shown in other countries. So although this came as a surprise to some people, it was not a surprise to lifespan developmental psychologists who have known for a number of years about something that we refer to as the well-being paradox. And this is the idea that older age is associated with better emotional well-being, even though later life is often characterized by losses and limitations in physical functioning. So two main theories have been developed to explain this well-being paradox within the lifespan developmental literature. And I'm going to take you through both of those theories. The first one is socio-emotional selectivity theory, and this is Laura Carstenson's theory. It's the idea that as we age, we become increasingly aware that time left in life is limited. And this is accompanied then by a shift in motivation towards focusing more on enjoying life in the here and now. So from the perspective of socio-emotional selectivity theory, then this well-being paradox is a reflection of these lifespan changes in motivation. The second theory is the strength and vulnerability integration model. And this model tries to put together different components of the aging process. So it talks about strengths in coping that people develop with age based on their life experience. And one of these strengths, and a key strength in the SAVI model, is that as we age, we learn what situations stress us out and we avoid those. And that is a contributor to better emotional well-being with age. However, SAVI also notes that when we are faced with unavoidable stressors that last over a sustained period of time, physiological vulnerabilities that increase with age can limit our ability to cope. And so in those situations, then those benefits of aging are reduced and potentially even reversed. So some evidence in support of SAVI emerged from some data collected early in the pandemic in the Netherlands that it was a panel study. So they were able to compare, in this case, what's being shown here is negative emotions in the a time period before the pandemic and then during the pandemic. And what that graphic shows you is that the benefits of aging in terms of reporting less negative emotions was reduced compared to before the pandemic. Now you see there's still an age-related advantage, but it's narrowing. And this data, as was the case for the early UAS data, was collected during the early months of the pandemic. So one of the questions then becomes, from the perspective of CIPHER, whether or not eventually this well-being advantage disappears as people experienced these unescapable stressors over time. The other issue that arises when we think of some of the tenets from CIPHER is how pre-existing vulnerabilities in terms of mental health problems might make older adults who have symptoms of mental distress prior to the pandemic, if they would be more vulnerable to psychological distress than others. And we know from other research that was conducted during the pandemic that pre-pandemic distress was a significant predictor of increased risk of distress during the pandemic. So with that background, then we had two primary research questions that I'll talk to you about today. The first is whether there were age differences in psychological distress that persisted across the first 16 months of the COVID-19 pandemic. And then second, whether age differences in distress vary depending on the pre-pandemic diagnosis of anxiety or depression. So the two theories I talked about then offer competing hypotheses. Socio-emotional selectivity theory predicts that older age will be consistently associated with less distress because it reflects this larger shift in time perspectives that drives differences in motivation. The CIPHER model suggests that the association between older age and less distress will decrease over time due to older age being associated with greater vulnerability to these unavoidable sustained stressors. So the participants in this study were from the Understanding Coronavirus in America sample associated with the Understanding America study. And I don't need to talk too much about the UAS at this point in the conference. So, but we're dealing with 29 waves of data collection here. So this is all the data that was available when we started the analysis, although it's a moving target and there's more data now. So to measure psychological distress, we use the measure of the patient health questionnaire, the PHQ-4. This is a well-known measure within the psychological literature. It asked people to report their symptoms of anxiety and depression over the past 2 weeks. And then what we did was used a dichotomized score based on individuals' reports that corresponds to diagnostic criteria. So, and about 26%, oh, I guess that's the next slide. Go on to the next slide. Okay. Folks were asked, have you ever been diagnosed with anxiety or depression by a medical professional? So everybody's reporting on their symptoms that using that measure on the prior slide. And then people were also asked about their prior diagnosis of mental anxiety or depression. And then in order to try to figure out if that diagnosis had occurred before the pandemic, they were simply asked if that diagnosis was before March 10. And then we used that dichotomous score there as well, where 26% reported having a pre-pandemic diagnosis. The analyses were a logistic mixed model predicting psychological distress. So that dichotomous indicator variable. And then we looked at interactions, and the two interactions shown in red there are the ones that correspond to our first research question, the age difference over time, and then whether age interacted with having a diagnosis prior to the pandemic in predicting mental health. And then those two other interactions were also included in the model. So first research question then, do these age differences persist? The answer is yes, they do, but they become more narrow over time. So what that graph is showing, the oldest individuals in the sample are the solid blue line, the youngest people are the light blue dotted line. And what you can see is at the beginning of the pandemic, psychological distress was high for everybody, but even within that, it was highest for the younger adults and lowest for the older adults. And then over time, the spike decreased, and the age gap starts to narrow a little bit, but it's not because the older adults are becoming more distressed. It's because the younger adults are becoming less distressed. Okay. And then the second question, whether age differences dependent on the pre-pandemic diagnosis of anxiety or depression, the answer to that question is on the next slide. And the answer to that question is no. This age-related advantage that we saw across all these survey waves was independent of whether or not a person had a pre-pandemic diagnosis. So it's not the case that those two variables interacted. Instead, there was just a main effect of prior diagnosis on survey wave, where if you had a prior diagnosis, despite your age, whatever age you were at much greater likelihood of reporting psychological distress during the pandemic. But similar to what we saw with age, it does decrease, the difference between those two groups does start to decrease a little bit over time. All right, so in summary then, risk factors for psychological distress during the pandemic included younger age, having a pre-pandemic diagnosis of anxiety or depression. There were reductions in distress over time, especially for younger adults. And of our two theories, these are more consistent with socio-emotional selectivity theory than with CIPHER, because that age difference then is being maintained over time. And if the changes that are there are in the younger adults, not the older adults, which is what CIPHER would predict. So what's going on here, and this is one of the questions that, of course, we're very interested in, and unfortunately, we don't have in the UAS data, but some other folks who have been doing research during the pandemic, so some of their research suggests that the pandemic was more disruptive to younger adults who have future-oriented goals, because the uncertainty that the pandemic injected into society, that created more distress amongst younger adults who had to put their plans for the future on hold, whereas for older adults, they're already more focused on making the most of the time they have left, so it's less of a disruption. And that fits very well with the focus from socio-emotional selectivity theory. The other idea is that people of different ages are using different coping strategies, and that's consistent with CIPHER. And there is some research both during the pandemic and then research that my colleagues and I, including Andy Parker, who's here in the audience, conducted before, showing that older age is associated with less rumination, and that particular coping strategy seems to be advantageous during the pandemic as well. So just not ruminating about how COVID has ruined your life is a good coping strategy. So some of the limitations of the study, there are some really interesting cohort differences that have been uncovered in terms of psychological well-being. And so a comparison of middle-aged adults in 2010 to those in 1990 showed that that cohort of middle-aged adults was actually less happy. So it's possible that these age-related advantages that we're seeing now are reflective of a cohort effect. And so, for example, it'll be very interesting to see what happens when the millennials are middle-aged and older adults. What's their well-being going to look like? There's also selection effects, such as the fact that older adults with distress may have been less likely to respond. And of course, the way the UAS samples, the institutionalized older adults are not in the sample, and it's possible that things may look different for that group. And then finally, the implications. We need to be thinking about how to reduce psychological distress, especially in our young people. And one way to do that is to increase the availability of mental health services. I think the COVID pandemic showed us that remote telemedicine can be a viable strategy for getting people the care that they need. Smartphone apps have also shown some utility. And just a shout out to the earlier presentation, this idea of precision medicine, I think is just incredible in terms of thinking about how you might, get help to people in real time when they need it. So, all right. Thank you.